Well, it depends if you've been having treatment in between that period. So that would mean that you were responding to treatment. If your chromogram was very high and then you came in 6 months later and it was lower, it would mean that you were responding to treatment. When I say fluctuate, I mean, it could be, 30, 40 here or there. You know what I mean? That doesn't mean anything. It could do with, maybe whatever the stress or you're under or something like that, but it's not particularly, disease related. But chromogranin A is a protein that we find in our blood. So if somebody came out and took my blood test, chromogranin A, I would be within normal limits, I would hope, as somebody who is disease-free, okay? If you came in and got your chromogranin A tested, and we'll just say you have a neuroendocrine tumour, whatever stage it's in, it also could be normal, okay? Somebody else comes in, neuroendocrine tumour, and that could be raised. But what we want to do is get a baseline so that if the disease changes in any way, metastasize, whatever, that we've a baseline to go on. So we can say, when you came in, your chromogranin was this. Now, 3 years later, it's starting to rise a bit. So you can still have a normal chromogranin A and have a neuroendocrine tumour, but it's still. Even though I say it's a gold standard, and I'm just going through each test individually, but you obviously can't take, the tests individually. You have to put them all together and, look at it as a full picture.
What is the normal standard then, the range for chromogranin? Or is there one? Is it individual?
No, but it's individual to each kind of centre, which is the other confusing thing as well. So that's why we always say to try and have, I know people are coming from Cork and Limerick and Galway, and sometimes they'll say, can I have my blood taken down there? Now, as much as, you want to be accommodating and say, but all the reference ranges can be different, and, the staining can be different. So that's why we always like to have people having their blood done in the same centre that they're being looked after. Does that make sense? Because I'm sure in France as well, it's...
You go for the chromogranin, you go to a lab, laboratory. They like you to go to the same laboratory.
Yeah. But
that's taken it in the hospital. I just go to the local laboratory and they
Well, I think they're trying to implement that now. I think that's what Dermot O'Toole was saying. They're trying to get guidelines, and something like Mark was saying that you'd come in with a standard sort of tick box, to say I've had this done and I've had this, and.
Sorry, just the sheets that we wanted to give out this morning didn't arrive on time. They are out on the table, so please take a few each.
I might just have a quick look as well. Yeah.
We didn't put it by.
No, just to see.
Just the date of your consultant name, the date of the visit, and then an MRI or CT. Make sure it's at least 4 weeks in advance of that date. Your CGA, your 5-HIEA. Make sure they're 6 weeks in advance of that date. And then space for some notes and that when you go to your time. It just might help just in planning and getting things organised. Thank you.
I just want to, that's lovely, thanks. Yeah.
So I think it might be useful just to use it as a planning and getting organised.
Yeah.
I mean, everybody I would say gets CGA and 5-HIEA. Would that be fair to say? They should be, I think.
Well, they should.
You should get the 5.
Well, first of all, we just so the chromogranin A is the first, blood test that will be specific to your neuroendocrine or carcinoid. So, as I said, most people here put up their hand. Okay, a couple didn't. So that's something that you should request. Absolutely, to have a baseline one. Because not only does it confirm the diagnosis, as I said, it does monitor your disease, and it also monitors your response to treatment. So it's quite an important blood test. The other, Mark just mentioned there, the 5-HIAA. I was just going to pass that around just while I'm talking about it. Has everybody had 24-hour urine collection of 5-HIAA? Yeah.
It must be 24 hours.
And it has to be 24 hour, start at 7 o'clock in the morning, for example, or if you're a late riser, it can be later than that. But 7 a.m, I think so often we get older people coming in, and it is kind of a hard concept to understand. 7 o'clock in the morning, you avoid your first urine and you throw that away. And then you continue to collect, you start collecting your urine from that one that you've thrown out, all the way through for 24 hours till 7 o'clock the next morning. And then you finish. And you have to clearly mark, normally you get a, I think I just brought
Is that the CGA?
No, I've moved on now, I'm talking about the urine, 5-HIAA. I was just trying to see if I...
Just done once?
Which?
24-hour urine sample, you just do that once?
Once ever, you mean?
Yeah.
No. We sort of, maybe once a year, it depends as well on your disease, but we just say annually, and then the chromogranin A twice a year, okay? Now this is just because as I say, I know most of your faces, and I'm aware that it doesn't mean if you're having it done, twice a year and you're having it once, it doesn't mean that you're not being looked after properly. But I'm just saying in general. So this is the Vincent's chromogranin A sheet request form. So you might have, I don't know if that looks familiar to you all, but anyway, and that the chromogranin A is the last one on the left there. So I don't know if you want to just pass around just for everybody to see it. And then this is the request form for the 5-HIAA, which is the 24-hour urine collection. And I just passed around a sheet there. The other thing is that you have to avoid certain foods that have serotonin in it. There's a list there. I won't go through them all, but I don't know if you're all aware of that as well. All that kind of stuff.
Because I haven't had it for years. I'm not on treatment for my cancer at the moment. So I haven't had it. I haven't done the 24 hours.
Right, with the acid in the bottle, that's always how you know it's for the 5-HIAA.
Are we supposed to have that always once we're endocrine choose?
Well, it's... No.
They didn't do it in Sweden, and I went there.
Right. But you had it at the start.
I had it when I was having chemotherapy.
Right.
Lutetium and came on.
Yeah.
Obviously Lisa's not a doctor or a consultant on this, but I think it's worth asking your own doctor. Like Lisa's telling us about the tests that are normal and typical. So it is worth
Yeah, no, I know, as I said, the general sort of thing is we would do kind of every 6 months, we'll just say the chromogram and the blood, and maybe yearly. But I think if I asked everybody here, they might say they had it done once maybe and then not again. Would that be fair or not?
Or not at all?
Say that again, sorry?
I said if you haven't had a symptom of the disease,
Yes.
and you're SDHB positive, and you have the chromogranin A, and you have the 24-hour urine done, how often should you have that done as a monitoring tool?
Well, I would say twice a year for the chromogranin and yearly for the 5-HIAA, unless...
If the chromogranin A rises, is that an indication of the progression of the disease?
Well, it is often, yeah. Often it is, but as I say, if you just take them individually, sometimes it's hard to assess. You would have to do all of the tests along with it. Because the other thing, sometimes when you say to patients, oh, the chromogranin A, and it's, so that people come in and they're so anxious, that it's gone up 10 or 20 or, and it's counterproductive then nearly, because people are like, what's my chromogranin? And they're nearly obsessed with it and the level of it. It doesn't always mean that the disease is active or has spread or, So I suppose just always be aware that you have to have all the sort of pieces of the jigsaw together before you see the full picture.
Looking at this form, I was surprised at the delays, 6 weeks.
6 weeks before the CGA and cycle.
Oh yeah, the only reason, the only reason I had said about the chromogranin for 6 weeks was because here in Vincent's they do them in batches. So we'll just say if you come in on the 1st of July and get your blood test done, a chromogranin, they bring it up to the lab on ice, but they only have yours. So 4 more people will come 2 weeks later and get their blood test done. and they add that to the batch, and then 2 more, that's only 5, so they wait until they've a certain amount, because it's so expensive, the staining and everything. So that's why I said at least 6 weeks, because it could be 2 weeks if you are lucky enough to come in at the last one of the batch, if you know what I mean.
But the worst thing is if you don't have that result though, when you're going to see the
Yeah.
consultant, or if your case is going to an MDT,
Yeah.
you're losing out by not.
Yeah,
So at least 6 weeks means you can be sure. that
Well,
it's
that's
going
what
to
I
be
was
there.
just saying. I just kind of said 6 weeks so that you give yourself kind of plenty of time,
What's the deterioration rate of the quality of the sample that's being taken?
No, it's fine. Well, it's on ice as well. So I presume they just, yeah. So, sorry, I was just going to say about the urine, the 5-HIAA, and that is just, it's I was just going to explain it there for you. It's a breakdown of the product of serotonin. So we all have serotonin naturally occurring in our body, and normally it breaks down in the liver of a person who's disease-free, and it's passed out in the urine. So when serotonin when your body isn't working properly, the hormones and everything, you get an excess amount of serotonin being passed, or the byproduct of it, which is 5-HIAA. So that's why you'll get a rise in your 5-HIAA, just so you can understand that. Is that okay? Does anybody want to ask me anything about that before we...
Do any of those tests show whether these tumours are active or non-active? Or is that something that you should be told about when you see
Well, I mean, if you have a raised chromogranin A and a raised 5-HIAA, we would go on then to do further scans, even if you had symptoms or not. Because sometimes you will have symptoms with raised biochemical markers, and sometimes you won't. So we would, if you came into me and you had raised chromogranin A and 5-HIAA, we would go ahead and do, further scan, or, to investigate. Or even just repeat the blood tests if you're feeling well, repeat them just in case, it might be just... Is that okay with everybody?
Yes.
I know you're probably all very familiar with
Yeah, I would never have had the 5-1-HA.
Yeah, I was going to say, don't ask me to have to say it, but the hydroxyindolate acid or something. But anyway, yeah.
I would have had urine tests done, like, as you say, the second one of the day, and not in an acidic bottle or whatever that you mentioned, just a normal urine test.
Are you sure it wasn't for something else?
No, it was just a simple, what you call it, urine sample, and second urine sample of the day, and that was it. Nothing over a 24-hour period or anything like that.
Right.
So what could they read from that, or is it not enough? Or?
Well, I don't know what your personal sort of case is, but I can talk to you afterwards if you like.
Okay.
What hospital are you attending?
Galway.
Galway, yeah. And is it an endocrinologist, you see? Yeah. I'm sure they would, and have you had a chromogranin A?
Yes.
Yeah. It might be, yeah. You can talk to me later maybe about it, I'm not sure. You mightn't want to, share with the group everything. And just, the problem we have, just the practical thing in Vincent's, is because the 24-hour urine bottle comes with acid, you can't keep it in the clinic, so you have to go upstairs, to the 3rd floor to pathology and get the bottle and all that. I'm just saying it's not very kind of cohesive, that you have to keep running up and down this.
Sorry, when you're returning, can you just return it into the thing downstairs, or do you have to go back up to the lab?
Last time that you go downstairs for
Yeah,
me,
it did
just
for me, but I just
before
thought
they take the
I was
blood.
supposed to bring it up. No.
Well, they
Sent
said,
it off.
they said to me, yeah, you're supposed to, but if they didn't mind, do they?
No, he took
Perfect.
it.
Well,
I
there,
went
that's
to-
great.
I went into him and he said, yes, I'll
Okay,
take it. And
just the little reception there in phlebotomy.
Yes,
Yeah.
yes.
Okay, so that's good that you don't have to go back up again. So I don't know, maybe it's they'll give it to us in a locked press or something that we can open and give to all you responsible adults, So, and there's obviously other specific blood tests that people would get hormone blood tests, different ones, but these are just the very general main sort of ones. You know, you'd have gastrin and other blood tests depending on where your tumour is located as well. So I was just going to move on to some of the radiology, unless anybody wants to say any more about the blood or urine or anything like that.
Bilirubin. It's liver.
Yeah.
Test. They give in France.
Yeah.
Bilirubin. Is that the right word?
Yeah, well they don't, it's not, you know, that's kind of a generalised test they do, but they wouldn't do it always unless maybe you're symptomatic, or, you know, I know in the other session they'll be talking about the injections, and often, you know, that can give you one of the side effects is gallbladder stones and stuff like that. So unless you're symptomatic, I think they wouldn't really be checking it. So I was just going to say, so you've had your blood, you've had your urine. CT scan is the next really test or investigation you would have, and that's just computer tomography, and it's really like similar to an X-ray. They use a type of X-ray and they just sort of have slices of the inside of your body, so they literally just slice. I mean, they obviously don't the picture, just slices, so that the radiologists can see the size and shape of your tumour, okay, and obviously the position of it as well. So that's just a two-dimensional kind of X-ray that I'm sure everybody here has had a CT scan. Anybody not have one? Okay, so that's the only thing everyone's had.
Can I just ask you a question?
Yeah.
That must, I think Donal or Derek mentioned it today on the stage that a CT should always be carried out with contrast IV.
Well, it shows a better picture, but sometimes people can't have the contrast.
Yeah, but
you
if
know,
you could.
yes, and also he was sort of mentioned about the arterial phase.
Yes.
That it, you know, it's so often we'll write extra things on the card, the request card. You know, yeah, but sometimes people can't have the contrast.
Course,
you know, yeah.
Is that stuff you drink?
Sorry.
Is that stuff you drink?
Yeah. Or sometimes, yeah.
Injected.
It's what?
So he said it was like licorice. I didn't taste it, and he didn't like it.
Well, lucky he wasn't getting scanned then, wasn't it? Yeah.
They don't put any orange juice or anything into the iodine contrast again. And I didn't get any pre-warning about it actually going inside of my mouth. Obviously I'm on chemo at the moment. And there's no contraindications before you go in as a chemo patient, but it can cause mouth problems. It's just to highlight really that people that are going in there, that, you know, a toothbrush and toothpaste and a mouthwash might have been very nice on the day.
Right, and that's in Waterford, is it?
That's a Waterford, yes.
Right.
Next time I'll go with the orange juice.
Yeah. And then MRI. I'm sure everybody has had an MRI here as well. Yeah.
Yes. Between an MRI and a CT, why another family member, one went for a CT and then in a different country, they were sent for an MRI. Is there a difference, or is it protocol?
Well, CT is probably the first one they normally do a CT scan. It's a type of X-ray, as I was saying, and it's two-dimensional. Okay, so it's a very good, gives a very good image of all the structures inside your body, all your organs and bone and all that kind of thing. Whereas an MRI uses magnets, so there's no radiation, or, you know, whereas CT scans, you're obviously getting a lot of radiation.
And we say an initial diagnosis, do you do CT scans in Vincent's or MRIs?
Both. Yeah.
Depending on the patient?
No, normally both.
Both.
Yeah, normally both. Normally they do an MRI if the liver primavist is a kind of contrasted dye, and that's another kind of real gold standard kind of investigation. But you do a CT first, is more, that's kind of the X-ray and like an X-ray, and then the MRI, as I said, it uses magnets to look at your, you know, to take pictures. And so often we'll say, you know, if you have a patient who's coming to you for 10 years, or, you know, if you can, you'd rather them having MRIs. If it's the appropriate investigation, because it's less radiation that,
The MRI is less radiation.
well, it's no radiation because it uses magnets rather than.
Is there a limit to the CT scans, the number of CT scans?
What?
Is there a limit to the number of CT scans?
No, I mean, as kind of you have to monitor your disease,
Over a lifetime.
Yeah. So, sometimes you just, if you had a choice between doing a CT scan and an MRI, they would choose, or even maybe an MRI and an alternate years, MRI 1 year and CT the next year, something like that, So, I mean, you can always suggest that when you come into clinic and you're, the consultant saying you're for a CT, you could always say, would an MRI be, as useful or something, just so that you're aware. But sometimes it's not. It depends what they want to look at,
Why would you do two at the same time?
What?
Would you have an MRI and a CT at exactly the same time?
Because it shows up different images and different. MRI shows up soft tissue, whereas the CT doesn't really.
Can you have them on the same day? Like if you
Yeah,
get them
yeah,
scheduled?
yeah. But as you know, that's very hard to do, I think, isn't it, in Vincent's?
For long scanning, is an MRI or a
Say that
CT
again?
for long
Normally they
scanning?
do
CTs
CT
in the lungs,
thorax, yeah.
What about the ultrasound?
Yeah, yeah, I'm coming to that now in 1 minute. Yeah, not at all. I just said I do the kind of ones that you would know. So really an MRI kind of gives a better, higher detail than a CT.
When you talk about a CT and then CT with contrast.
Yeah, that's what the lady, she was just saying. Yeah, that contrast you can see better, the images. But sometimes people can't take contrast for different reasons, So I'm sure would most of you had CT with contrast?
Yeah.
Yeah. So.
They would do a creatinine test first.
Right. Yeah. Kidneys. That's right. Yeah.
But is it easy to get in that IRM MRI in here?
Yeah.
Because it's very difficult
Oh,
in
is it?
France to get an appointment. You might be called in at midnight or till I've been called in at 11 o'clock at night. Haven't been able to get an appointment in time for the oncologist, etc. Couldn't get one.
I
in the
think
hospital.
I can't remember. Is it MRI is easier than a CT? Am I right, or is it the other way around? Yeah.
It's the other way around in
Yeah.
France.
No, I think it's. I don't know if you. I know in the public hospital, obviously this is where everybody attends. It's just, sometimes it can be a long wait. But if most of you are kind of every 6 months, we know 6 months in advance that you need a CT or an MRI. Do you know what I mean? So we can it's more if you need it sooner, in 6 weeks or something coming.
You're very quick at the dates if you need to get it done.
Yeah,
Do get
well,
it
hopefully, sometimes.
Do your best.
Yeah.
So if they didn't see enough, Lisa, on a CT scan, would they then order
An MRI.
an MRI or a scan?
Or if they saw something and then they wanted to see it better, if kind of more detail, they'd get an MRI. They'd order an MRI. So it's really, kind of step by step. You start, blood, urine, and then radiology, and then tissue samples of your biopsy, all the way to a full kind of diagnosis, so that they can look at the best treatment for you. Okay. So then, as Nikki just said there, the octreotide scan or octrio scan. How many people have had one of those?
Is that the isotope?
It's one they put radiotherapy into.
Isotope scan, is it?
It's octreotide. So it's over 3. Well, here it's over 3 days.
You have to stay away from kids.
What?
You're radioactive with the little one.
You have to stay away
Yeah,
from
they
children,
kind of.
but-
Yeah.
They want you to sort of drink as much fluid as possible, water or fluids to dilute it as possible. Do you think you had it here?
They called it an isotope.
Was it here?
Galway.
I was in Galway. And was it over 3 days?
You had one, then another one the next day, didn't you?
I think so, yeah.
Yeah.
Does it have to be over 3 days? I went on a Galway and I went back for on day and the machine was broken. That's all right.
What did you say?
So say that again. So yeah.
I had it done say, on one day on Tuesday for the rescan.
Yeah.
The machine was down. And
Did you go the day before as well though, or was it just one day? And
one scan one day and one day.
well, I don't know. That doesn't sound very. I'm not sure.
And he's had it twice, and it's only ever been. The first one he had was just one scan, and then a few weeks later he had. And he was supposed to have it done that afternoon at 3 o'clock, and then 9:30 the following morning. But they just kept him in the machine for an hour and 20 minutes. Said he didn't have to go back the next day at all.
Yeah, I'll send it out. They do a quick one for about 20 minutes.
And then change
they do
it
another
around.
longer one then.
Yeah.
Something about
You
it
have
there.
to wear that band so you can't go near pregnant women or children.
Yeah. Well, some hospitals do it in 2 days. I know that, but here it's 3 days. So I don't know whether maybe they just do it 2 days, and then I don't know how they
Would they
finished.
see how it was on the scan or something that
It comes up
was
like
okay
bright
that they wouldn't
green.
continue and do the other one?
I'm not sure. I'm not
They
sure.
seem to be happy with the first one.
I don't know. I'm not sure because it doesn't sound.
I know my husband had a scan in the background clinic and it was over. It was meant to be over 3 days, but he just went for 2 days and they said anyway.
Yeah, but this was only 1 day. Yeah, that sounds a little bit strange to me. When was that? And if you ever have to have another one?
They're talking about it now.
Where will you have that? Right. Okay. I think I'd probably say to them what happened the last time and just say, just maybe you could ask them what happened, maybe not. It doesn't sound right to me, to be honest. Yeah. Sorry, I was trying to find thing I had an octreotide scan there.
Galway don't like you querying their procedures though.
What?
Galway don't like you querying their procedures.
Even the radiologists? Well, I don't know. I'm sure you could put it a polite way, but sorry now. I just want to see. Octreotide scans. They're not really. It's a one, and then somebody had said to me, they do them 5 yearly, every 5 years. But to be honest, at the moment, it's kind of. I don't think there's a particular guideline to say how often to do them. Has anybody had more than one octreotide scan?
I have 2 in the year, and they're horrible, absolutely horrible.
Yeah.
You have to lie with your hands over your head for 1.5 hours. The pain in your shoulders and your arms.
And why did you have to? Were you having more because your disease was progressing, or it was yeah. See,
I had it from the beginning too.
yes.
And then it was progressing. And then
Yeah.
And I hate them with a vengeance.
Yes.
Extremely, especially if you have arthritis or anything in your shoulders and your neck. To lie like that with your hands over your head for 1.5 hours. But they said today that if we get this PET scan, that we can do away with the
Gallium PET, yeah, which would be fantastic, wouldn't it? Yes. Yes. Yeah. So it seems to me at the moment that the octreotide scans are done initially, and if they think your disease has progressed, rather than something that they do annually or something, Are we?
Can we wind up now?
Okay. Last thing I'll just say, because you probably know about the PET scans and there's other kind of scans, but one of the things I just wanted to mention was the tissue sample, because Mark had said the Ki-67. You might have heard of that, and most people kind of say to me, what is that and what does it do? So the Ki-67 is a protein, and it's associated with cell proliferation. So it's associated with cell activity. And what the pathologist does when he gets a little sample of your tissue, of the tumour, he stains it, and under a microscope he looks at all these cells and he magnifies it as much as possible, and that's called the mitotic count. I don't know, you might have heard that term as well. So it's the amount of cells that you can see magnified as much as possible, so say 400-fold or whatever. So they're looking at that and they're comparing the cells that are actively dividing and the cells that are rest phase, okay? So only the cells that are active are producing the Ki-67. In the resting phase, they're not. So they look at that and they count that up. Literally, the pathologist counts that by hand, how many cells, and he adds it all up and then he gives a percentage of the Ki-67. So if you have a low percent, that's poorly differentiated, or that's well differentiated, so that's a better prognosis in a way. A moderate is obviously the middle, and then higher is more aggressive. You know, so I know people have come and they're 90, Ki-67 is 90%, Ki-67 is 1%, you know, so we have a whole range from kind of 1 to 100.
If it's low count, it's poorly differentiated?
No, sorry. If it's low Ki-67, it's well differentiated. So if you kind of think that the faster the cells are dividing, the more aggressive the tumour, if you understand, okay? Sorry, now I know that's...
vary quite a bit. Multiple tumors.
Ki-67 can be different in your primary than it could be if it's spread somewhere else. There can be a big difference as well. Sorry? Yes, no, it can, yeah. Yeah, it can. Yeah. And that's all part of the kind of grading system as well, you know, that they would... No, I don't think so. I'd say they take the highest percentage, yeah. Especially if you're going on for chemotherapy or something like that, they take the highest one, yeah.